In yesterday's class, we have discussed about the cholinergic agonist drugs, which are directly acting on the muscarinic and nicotinic receptors that we have discussed. So in today's class, we'll try to discuss the cholinergic agonist drugs. This is the second part of cholinergic agonist. In autonomic pharmacology, this is the third part. Anyways, देखो, in previous class we have discussed that in cholinergic agonist drugs we have directly acting drugs and indirectly acting drugs, right? Directly acting drugs, what they do? They will directly go and bind on the muscarinic and nicotinic receptors, and through that they will show actions of acetylcholine. And in indirectly acting drugs, what they do? They will inhibit the acetylcholinesterase enzyme, ACHE. Acetylcholinesterase enzyme is inhibited, and when this enzyme is inhibited, what happens? The acetylcholine is not metabolized and acetylcholine concentration increases, and through that it will increase the muscarinic and nicotinic actions by increasing acetylcholine. So here indirectly acting drugs are increasing acetylcholine concentration, and the directly acting drugs are directly having the receptor actions. They'll go directly to the receptors, they'll bind on the muscarinic and nicotinic receptors, and they'll show cholinergic actions, muscarinic and nicotinic acetylcholine actions. This thing we have discussed in yesterday's class. Now let us discuss in detail. Yesterday I was telling you the in indirectly acting drugs we have reversible inhibitors and irreversible inhibitors, right? So to understand that concept, let me tell you one more basic thing. सब लोग ध्यान से सुनो. Everybody try to listen carefully, because this is little bit deeper concept. Actually, for clinical pharmacologist and all, we don't require all these things. For pharmacologist, we should know. Being a pharmacologist, we should know. See, just imagine this is a acetylcholinesterase enzyme. Okay, acetylcholinesterase enzyme has two sites. One is anionic site and one is cationic site. One is anionic site and one is cationic site. ध्यान से सुनो, this is acetylcholinesterase enzyme. Okay, acetylcholinesterase enzyme. When acetylcholine ACH, acetylcholine comes and binds on this enzyme, what happens? When acetylcholine comes and binds on this enzyme, acetylcholine has one positive site and one negative site. I mean, जो भी है उसके sides, acetylcholine will bind on the both anionic site and cationic site, and by binding acetylcholine on this enzyme, what happens? Acetylcholine will be rapidly hydrolyzed. That means this enzyme metabolizes acetylcholine. Clear? This point we have already discussed. Now you see, when acetylcholinesterase inhibitors are given, acetylcholinesterase enzymes, they will come and bind on same. They will come and bind on, some drugs will come and bind on the anionic site and some will bind on the cationic site, and few drugs will bind on both the sides. When acetylcholinesterase inhibitors, for example, we have neostigmine, we have pyridostigmine, we have organophosphate compounds. All these drugs classification in yesterday's class we have discussed. When these drugs are given, these drugs will bind on these any of the sites, anionic site or cationic site. The site is already filled with these drugs. So what happens? When the binding site is already binded by these drugs, competitively they are binding on these sites. So acetylcholine will not have chance to bind on these sites, right? Acetylcholine का जो है, acetylcholine can't bind, because neostigmine, pyridostigmine and organophosphate compounds are already binding on the receptor. So what happens? Acetylcholine can't bind on the enzyme and acetylcholine can't metabolize. Acetylcholine metabolism is not seen. So what happens? Acetylcholine concentration increases in the body. Through that, indirectly acting drugs will increase the concentration of acetylcholine. This point in yesterday's class we discussed it, but for better understanding, you see, just imagine this is the acetylcholine. Everybody, you can see the diagram. This is the structure of acetylcholine. This is the structure of acetylcholine. See, we have one anionic site and we have one cationic or esteric site. It is also called cationic or esteric site. Serine moiety is called esteric site, and we have anionic site. Okay, here we have glutamate site. Some glutamate रहते हैं यहाँ पे, glutamate site. See, the acetylcholine is quaternary ammonium compound, right? Acetylcholine is quaternary ammonium compound. You know the difference between primary ammonium compound, secondary, tertiary, quaternary ammonium compounds? Examples पता है आपको? Do you know the difference? You know or not? See, just everybody try to understand. This is ammonia, right? NH3, H, H, H. Yes, this is the basic structure of ammonia. Ammonia has three sorry, 3 hydrogens. In organic chemistry, you might have studied in first year. When, see, if nitrogen has one alkyl group and 2 hydrogen molecules, that compound is called primary ammonium compound. Okay. If ammonia, or if nitrogen has 2 alkyl groups, if ammonia has 2 alkyl groups, it is called secondary ammonium compound. And if nitrogen has 3 alkyl groups, 3 alkyl groups, it is 3 alkyl groups, it is tertiary, not tertiary, it is tertiary ammonium compound. And if the same nitrogen has four alkyl groups or 4 R groups, then it is called tertiary ammonium compound. I think you understood this basic thing. And in tertiary ammonium compound, it will have positive ion concentration. Anyways, see, the acetylcholine is the quaternary ammonium compound because it has 4 alkyl groups on its nitrogen atom, and it has one ionic site. See, these positive ionic site will bind on the anionic site of the acetylcholinesterase enzyme, and remaining the double bond O, double oxygen group will bind with the serine moiety, and through that it will try to metabolize the acetylcholine when it binds on the acetylcholinesterase enzyme. This is the general, थोड़ा depth में है, it is not necessary for us. This is how acetylcholine metabolized by acetylcholinesterase enzyme. Now you see, we have some acetylcholinesterases, or we have anticholinesterases. Anticholinesterases के अंदर we have examples. We have reversible binders, irreversible binders. Yesterday's class I discussed all these classifications. In this, if you take any of the drug, for example, if you take physiostigmine or neostigmine or pyridostigmine, these are reversible inhibitors. What they do? They will go and bind on the either anionic site or cationic site or esteric site, and what happens? They will not give chance for the acetylcholine to bind and to metabolize. Through that, they will increase the actions of acetylcholine. Okay, so this is how actually the acetylcholine and anticholinesterases binds on the acetylcholinesterase enzyme, and through that they will show, or they will inhibit the actions of the enzyme. Okay, I think you understood the mechanism how acetylcholine is metabolized and how anticholinesterases will show action. Okay, you just try to memorize this classification. We have reversible drugs and irreversible drugs, and these are the chemical structures of each molecule, all anticholinesterases. Now you see, just now I explained you the mechanism के बारे में. It's not necessary for us to explain in detail. Now you see, we will go with the individual drugs. Each drug is very important. Yes, anybody has any doubt? Yes, and listen carefully. So physiostigmine is the drug which is reversible enzyme inhibitor, reversible anticholinesterase inhibitor, right? Now you see, first very important point, physiostigmine, it is tertiary ammonium compound, tertiary amine. Let me tell you the structure. See here, physiostigmine का structure है. This is physiostigmine structure. Physiostigmine is tertiary amine. Okay, tertiary and quaternary amines you already know. And this tertiary amine, physiostigmine, is obtained directly from the plant. It is obtained from Physiostigma venenosum. So the name of this plant is Physiostigma venenosum. So this is the plant. From this plant, actually, from the fruits, the ripened fruits, and from the roots, from the leaves also it is obtained. More concentration of physiostigmine is seen in the fruits. So from these fruits, this tertiary amine, physiostigmine, is obtained. Okay, that is one important point. Now you see, physiostigmine has some very important characters. Number one, physiostigmine is absorbed very rapidly from oral route. It is rapidly absorbed from nasal route. It is absorbed from ocular route. From all the routes, मान लो, it is absorbed from most of the routes, and it is given usually from oral route. Oral tablets are available. It is commonly used with IV formulation, and sometimes it is used as subcutaneous form, and it is also given through IM route. Because see, all these routes are available because it is absorbed from most of the tissue, most of the roots. Okay, and it is preferred with IV only. It is preferred with IV. This is one point. And physiostigmine, ध्यान से सुनो, physiostigmine has high tissue penetration power. High tissue penetration power. Tissue penetration power बहुत ज़्यादा रहता. If it is applied on the skin, from the skin also it will be absorbed rapidly. That is called tissue penetrating power. If it is given through IV, from the IV it will be penetrating to all tissues. Tissues के अंदर penetrate हो जाएगा. This is one important point. And one more important point is it can cross blood-brain barrier. Very, very important point. It can cross blood-brain barrier. This is very important point. So it has CNS actions also. It has CNS actions. So physiostigmine is observed from all the roots, and most of the time the physiostigmine is rapidly metabolized by the enzymes which are present in the blood as well as in the liver. In the blood and in the liver we have esterases. We have esterases. Plasma esterases बोलते हैं. These esterases which are present in blood as well as in the liver, these esterases will immediately metabolize the physiostigmine, and through that what happens, physiostigmine is rapidly excreted from the urine, and its duration of action will be between 2 to 3 hours. Only 2 to 3 hours. That's it. Physiostigmine it is having high tissue penetrating power. It can cross blood-brain barrier. It has all routes of absorption, but it is rapidly metabolized in the body through esterases, and its duration of action is 2 to 3 hours only. Okay, so all these kinetics we understood. So what is the use? Physiostigmine का use क्या है? Physiostigmine has two very, very important uses. ध्यान से सुनो. First, physiostigmine can be used in glaucoma. Physiostigmine can be used in glaucoma, and very, very important point, physiostigmine is the drug of choice in belladonna poisoning. Let me repeat the point. Physiostigmine is drug of choice in belladonna poisoning. What is belladonna? What is belladonna? Anybody? Atropa belladonna. Atropa belladonna is the plant which has atropine. That means physiostigmine is drug of choice in atropine poisoning, atropine overdose, atropine toxicity. Atropine toxicity is called belladonna poisoning. Atropine poisoning is called belladonna poisoning. Okay, किसी भी पेशेंट में अट्रोपिन ओवरडोज हो गया तो व्हाट इज द ड्रग ऑफ चॉइस? अट्रोपिन ओवरडोज में ड्रग ऑफ चॉइस क्या है बोलो? फिजियोस्टिग्मैन. याद रख लो ये चीज. यू रिमेंबर दिस थिंग. और बहुत सारे एंटीकोलिनेस्टरेजेस वी हैव. अदर एंटीकोलिनेस्टरेजेस आल्सो. आई टेल यू द डिफरेंसेस हियर. ट्राई टू रिमेंबर द इंपॉर्टेंट पॉइंट्स अबाउट दिस फिजियोस्टिग्मैन. फिजियोस्टिग्मैन के इंपॉर्टेंट पॉइंट्स कुछ ज़्यादा नहीं है. इट इज ऑब्जर्व्ड फ्रॉम ऑल द रूट्स. वन पॉइंट. सेकंड पॉइंट, इट हैज मोर टिश्यू पेनिट्रेटिंग पावर. थर्ड पॉइंट, it can cross blood-brain barrier and it has CNS effects. Okay, and it is metabolized by the esterases which are present in blood as well as in the liver, and it is commonly used for glaucoma and very, very commonly and drug of choice in belladonna poisoning. Belladonna poisoning means atropine poisoning. Clear? That's it about physiostigmine. Understood everybody? And its duration of action is 2 to 3 hours. Enough. अब देखो, we'll go with the next drug. Next drug is neostigmine. अब देखो, second drug is neostigmine. नियो मीन्स न्यू. याद रख लो, नियो मीन्स न्यू. फर्स्ट ड्रग कौन सी थी? फर्स्ट ड्रग वाज फिजियोस्टिग्माइन. हाँ, फिजियोस्टिग्माइन. फिजियोस्टिग्माइन is obtained from plant, right? It is tertiary ammonium, and from the physiostigmine usually the plant oriented drugs will have some lethal adverse effects because of their many properties. Okay, due to high tissue penetrating power or due to many things. So physiostigmine has few drawbacks. So to overcome that drawbacks, what we did, we tried to synthesize new form of physiostigmine, which is neostigmine. So neostigmine is it is a tertiary ammonium compound. It is a tertiary ammonium compound which is synthesized in the laboratory. So it is semi-synthetic form. Neo means new. Physiostigmine से new बनाया है. That's why it is called semi-synthetic. Okay, neostigmine is semi-synthetic form and it is tertiary compound. This is one difference. And see here. Listen carefully. Neostigmine is available in oral form. It is available in IM form, IV form, parenteral form, and different forms, all other forms. One important point, this neostigmine is very poorly available from oral route. Oral absorption is very low. Oral absorption is not as much as physiostigmine. Physiostigmine से ज़्यादा नहीं रहता. It is less. सो इसका प्रीफर्ड रूट क्या होगा? प्रीफर्ड रूट इज पेरेंटल रूट. Preferred route is parental, so it is available in parental form very commonly because oral form bioavailability is very low. Clear? Now you see one more important point. It is synthetic. We know. See, very important point about neostigmine is not suggested for atropine poisoning. It is not suggested for atropine poisoning, but it is suggested, or it is drug of choice for myasthenia gravis. Let me repeat the point. Neostigmine is not drug of choice for atropine, but it is drug of choice for myasthenia gravis. It is इससे भी अच्छे ड्रग्स अभी है for myasthenia gravis, but as of now it is drug of choice in myasthenia gravis. Why it is used for myasthenia gravis? We have one reason. ध्यान से सुनो सब लोग. See, myasthenia gravis has two actions. Neostigmine has two actions. Neostigmine has two actions. क्या है वो दो एक्शन? क्या है? ध्यान से सुनो. सी, neostigmine directly goes and binds on NM receptors. Neostigmine directly goes and stimulates NM receptors. अब बोलो, what happens if NM receptor is activated? What happens if NM receptor is stimulated? Very good. It increases the contraction of skeletal muscles. मसल एंड प्लेस के पास वहाँ पे जब अस्टलकोलिन एक्टिविटी बढ़ा देगा, दैट मीन्स skeletal muscle contraction will be increased. So this is one direct action. This is direct action. And number two, what it does, neostigmine will inhibit the acetylcholinesterase enzyme ACHE, and through that what it does, it will increase the acetylcholine concentration in all other places. Through that also it will increase the muscarinic and nicotinic actions. Because of these two actions, number one, directly acting on NM receptor and inhibiting the acetylcholinesterase enzyme, it is increasing the actions of skeletal muscles and it is increasing the actions of muscarinic and nicotinic receptors. Due to these two actions, it is preferred in myasthenia gravis condition. About myasthenia gravis, I'll explain you. Okay. So neostigmine is preferred drug in myasthenia gravis because of these two important actions. Clear? Oral bioavailability is poor, but it is commonly advised in IV form and IM form. Parental route is very commonly advised. And इसके बारे में और important चीज़ क्या है? It is metabolized by plasma esterases and same like physiostigmine. Esterases will metabolize neostigmine. And one more difference is neostigmine is synthetic form and it is quaternary compound. क्लियर? फिजियोस्टिग्माइन का नियोस्टिग्माइन का डिफरेंस समझ गए सब लोग? अब देखो, अब आएगा. दिस इज वेरी इंपॉर्टेंट. दिस इज समथिंग सुपीरियर. इट इज सुपीरियर. Pyridostigmine is superior to neostigmine. Actually we were thinking neostigmine is better than physiostigmine, right? But neostigmine से भी pyridostigmine is very effective drug. It is having same to same actions like neostigmine, but it is having slightly longer duration of action. Number one advantage, neostigmine से pyridostigmine का advantage क्या है? Number one, it is having slightly longer duration of action. Number two, it is having more tolerability. It is having more toleration. Patients have more toleration with pyridostigmine. Neostigmine से भी ज़्यादा patients will tolerate with pyridostigmine. That's why, because of the longer duration of action and because of the high toleration property, pyridostigmine is the drug of choice. Pyridostigmine is the drug of choice for myasthenia gravis. Actually neostigmine is also advised, but neostigmine से भी अच्छा कौन सा है for myasthenia gravis? Pyridostigmine. याद रख लो ये सब. कॉम्पिटिटिव एग्जाम्स में अगर फ्यूचर में कभी आप लिखेंगे तो which is the drug of choice for myasthenia gravis, he will ask physiostigmine, pyridostigmine and neostigmine. So pyridostigmine will be the drug of choice, and he will again ask which is the drug which is used for atropine poisoning, belladonna poisoning. Again he'll ask these three questions. So here the answer will be physiostigmine for belladonna poisoning. I think you all are following me. Clear? Yes. Now you see इसके kinetics क्या है? Its kinetics is same like neostigmine. It is available in oral form, it is available in IV form, but preferred in IV formulation, and sometimes it is given in tablet form also. One second. I was explaining you that pyridostigmine is drug of choice in myasthenia gravis, right? अभी देखते हैं, we will see what is myasthenia gravis. Okay, myasthenia gravis. See, it is first thing. It is It is an autoimmune disorder. Autoimmune disorders means some autoantibodies will come and they will inhibit or they will destroy the proteins or receptors or enzymes which are present in the body. Okay, and antibodies, self-produced antibodies, will kill our own tissue. That is called autoimmune disorder. See, in previous class I told you, just imagine this is a ganglia, and on the ganglia we have N receptor, right? And or just imagine it is a neuromuscular junction. Neuromuscular junction के पास क्या है? NM receptors are there. Okay, we have NM receptors and NN receptors. NN is mainly present in the ganglia and NN is mainly present on the tissue end plate here, somewhere here. Just imagine this is a tissue, skeletal muscle, and on the tissues here we have NM receptors. NM receptor. Clear? See, some antibodies will come and they will destroy NM receptors. What they do? They will destroy NM receptors. अब देखो, when acetylcholine releases here on the neuromuscular junction, this is neuromuscular junction. At the neuromuscular junction, if acetylcholine releases, it should go and fall on the NM receptors and it should cause skeletal muscle contraction. Clear? Skeletal muscle contraction करना है. But here NM receptors are destroyed. So what happens when acetylcholine releases here? Acetylcholine will try to find the NM receptors. NM receptors ढूंढते जाएगा. When acetylcholine tries to find the NM receptors, between that time, the acetylcholinesterase enzyme, what it does, before acetylcholine finds the NM receptors, it will be metabolized by acetylcholinesterase enzyme. When acetylcholine releases here, it will go and find the NM receptors, right? But here already autoantibodies, देखो कभी भी देखो, autoantibodies or enzymes or receptors, 100% of receptors and 100% of autoantibodies will not be damaged. थोड़े बहुत NM receptors रहते बॉडी के अंदर. Few NM receptors are already present. Not 100% of NM receptors are destroyed. So the acetylcholine which is released here, it will try to find the NM receptors. Before finding only, it will be metabolized by acetylcholinesterase enzyme. So here, if we give neostigmine or physiostigmine or pyridostigmine, what pyridostigmine will do? Pyridostigmine will go and inhibit the acetylcholinesterase enzyme which is present here, and what it does? It will allow acetylcholine to search the remaining NM receptors, and what happens? Acetylcholine will show the actions on NM receptors, and by that patient will have skeletal muscle contraction. This is the general physiology of pyridostigmine and neostigmine in myasthenia gravis. Actually, in myasthenia gravis, the NM receptors are degraded and the actions of acetylcholine is not shown, and patient will have signs and symptoms like patient's skeletal muscle contraction can't be seen. Patient will have eyelid drooping. Patient's eyelids रहते हैं ना, eyelids, they can't open properly and they can't close properly. Eyelids open नहीं कर सकते. Hands and legs contraction can't be seen. They can't perform physical activities. They can't run. They can't kick football. They can't do physical activities. Cycling नहीं कर पाते. Why? Because skeletal muscles are not that much active. Because NM receptor नहीं है वहाँ पे. NM receptors were degraded. Okay. So because of that, patient will have myasthenia gravis. So in myasthenia gravis, what we do? We go with pyridostigmine. Pyridostigmine, what it does? It will inhibit the acetylcholinesterase enzyme and it will allow more concentration of acetylcholine to bind on the remaining NM receptors. Remaining means it will try to search the NM receptors. यहाँ पे देखो, myasthenia gravis में we are giving pyridostigmine only to improve the symptom. We are not trying to manufacture new NM receptors. New NM receptors यहाँ पे manufacture नहीं कर रहे अपन. We are not decreasing this the autoimmune action. Okay, pyridostigmine is only increasing it is improving the signs and symptoms. Along with pyridostigmine, what we can do? Along with pyridostigmine, to decrease the actions of autoimmunity, we can also give corticosteroids. Corticosteroids, antigen antibody reactions कम करने के लिए, immune system कम करने के लिए, we can go with corticosteroids. So corticosteroids will decrease the actions of autoimmunity. Okay, corticosteroids will decrease the actions of autoimmunity and pyridostigmine will increase or will improve the symptoms. So this combination is very effective combination for myasthenia gravis patient. I think you understood what is myasthenia gravis, what happens in myasthenia gravis. and the drug which is given in myasthenia gravis, how it acts in the myasthenia gravis. I think you understood this point. Okay, usually pyridostigmine ke dose we have usually 0.5 to 2 mg is available. Same like neostigmine, it is also absorbed poorly from the oral route and commonly available in IV form, metabolized in the liver. याद रख लो, actually the pyridostigmine and neostigmine are metabolized by two kinds of enzymes. In liver we have uh, cytochrome P450 enzymes, right? In liver we have cytochrome P450 enzymes, and in that we have two kinds of. The first one is carboxyesterases, esterases, and second one we have para oxonases, NASES, para oxonases. समझ गए? So these are the two types of enzymes which will metabolize physiostigmine and pyridostigmine and neostigmine in the liver. And if anybody has liver injury, these enzymes are not their activity is decreased. So what happens? More concentration of pyridostigmine can be seen. Anyways, chalo. We understood about physiostigmine, we understood about neostigmine and also pyridostigmine. Now we'll try to find out the next drug, very very important drug. We have endrophonium. Classification का next drug is endrophonium. Endrophonium एक एक ड्रग का एक एक सिग्निफिकेंस है. एवरी ड्रग हैज इट्स ओन सिग्निफिकेंस, सो रिमेंबर दैट एटलीस्ट वन पॉइंट. Okay, in exams it will be useful for you. So endrophonium is a quaternary ammonium compound, same like acetylcholine and same like pyridostigmine. Okay, it is available in IV administration and mainly it is used in diagnosis of myasthenia gravis. See, अब देखो, अभी तक अपन क्या करें इन acetylcholinesterase enzymes, anticholinestrases. Physiostigmine is used in, एक important point, physiostigmine is used in atropine poisoning, right? Atropa belladonna poisoning, clear? Neostigmine is drug of choice. It is a drug of choice, or it can be given in myasthenia gravis. And pyridostigmine is actual drug of choice in myasthenia gravis. Okay, actually neostigmine and pyridostigmine both are drug of choice, but neostigmine से भी ज़्यादा tolerated कौन सा drug है? Pyridostigmine. In both the drugs, in neostigmine and pyridostigmine, let me ask you one question. In both neostigmine and pyridostigmine, which drug is most effective drug? Effective मतलब which drug is having more efficacy? Efficacy. Who is having more action? Who is having more action? In that, neostigmine is the answer. Why? Because neostigmine has two actions. By two actions, neostigmine is actually used in emergency myasthenia gravis condition. Emergency में neostigmine दे सकते हैं, and in normal cases pyridostigmine. For long term use we can go with pyridostigmine. Why? Because neostigmine has two actions. Directly neostigmine क्या करेगा? NM receptor को activate करेगा. This is one action, and second action is enzyme inhibitory action is, that is common. So because this is the special action of neostigmine, याद रख लो. And pyridostigmine is drug of choice in myasthenia gravis because it is having more toleration property. अब देखो, और एक पॉइंट हियर, एंड्रोफोनियम इज नॉट यूज्ड फॉर अ डिसीज कंडीशन, बट इट इज यूज्ड टू डायग्नाइज द myasthenia gravis. अब आप लोग पूछते सर नियोस्टिग्माइन पेरिडोस्टिग्माइन दिए तो भी डायग्नोसिस हो सकता ना, एंड्रोफोनियम ही क्यों देते? डायग्नोसिस करने के लिए एंड्रोफोनियम इज ड्रग ऑफ चॉइस बिकॉज एंड्रोफोनियम हैज वेरी वेरी रैपिड ऑनसेट ऑफ एक्शन. एक बार इंजेक्शन दे दिए, सी पेशेंट वाज हैविंग, मान लो पेशेंट इज हैविंग myasthenia gravis symptoms. myasthenia gravis के symptoms क्या है? Patient has very loss of skeletal muscle activity. Patient has drooping eyes. Patient sometimes smooth muscle contraction नहीं दिखेगा. Patient will have constipation. Patient can't swallow properly. Patient swallow नहीं करेगा. Patient can't swallow because skeletal muscles, pharyngeal muscles, skeletal muscles है, that is not showing the actions because NM receptors पूरे डैमेज हो गए. तो यहाँ पे if patient has these symptoms, if endrophonium injection is given rapidly, suddenly within minutes ये जो पूरे साइंस एंड सिम्टम्स है ना, वो साइंस एंड सिम्टम्स पूरे कम हो जाते हैं. इमीडिएटली पेशेंट साइंस एंड सिम्टम्स विल बी इम्प्रूव्ड, एंड आफ्टर सम टाइम अगेन पेशेंट विल गो विद द नॉर्मल साइंस एंड सिम्टम्स. सो बिकॉज ऑफ दैट एंड्रोफोनियम की एक्शन जब तक दिखती है तब तक सिम्टम्स विल बी इम्प्रूव्ड. ओके, सो बिकॉज ऑफ दैट रीजन एंड्रोफोनियम इज कॉमनली यूज्ड इन डायग्नोसिस ऑफ myasthenia gravis. Okay, and in sometimes in myasthenia crisis conditions में and in cholinergic crisis conditions में we can use. ओके एंड एक्चुअली डिफरेंशिएट करने के लिए यूज़ करते हैं मेनली इन माइस्थेनिया क्राइसिस में वी कैन गो ओके एंड्रोफोनियम के बारे में दैट्स इट इज़ नॉट more than that is not required. Now you see one this is important, little bit important. Actually we should study the difference between physiostigmine, neostigmine and pyridostigmine. I'll add pyridostigmine also here, pyridostigmine. Okay, now you see, just now I told physiostigmine is obtained from physiostigma venenosum, right? It is obtained from plant and it is tertiary amine and it has very good penetration power, that also I told. Okay, and it crosses blood brain barrier and produces central effect. Okay, that point I told. And it is used in atropine poisoning, that point also we already studied. Now you see neostigmine का क्या है? It is a synthetic form, yes, and it is a quaternary ammonium compound and has very poor penetration. ये ज़्यादा है तो ये penetration कम होगा and it does not cross blood brain barrier and has no central effects. And इसके uses देखो, it is used in post operative urinary retention, paralytic ileus. In yesterday's class we discussed these two disease conditions. And it can be used in myasthenia gravis and it also can be used in Cuvier poisoning. Okay, it is a type of atropine related drug poisoning. In that conditions also we use neostigmine to increase the actions of acetylcholine. Actually Cuvier poisoning में acetylcholine actions कम हो जाएंगे, so in that condition we use neostigmine. So this is the difference. And about pyridostigmine, if we say among all these, see pyridostigmine, it has long duration of action, number one, it has more toleration property, and it is the drug of choice in myasthenia gravis. That 3 points you remember about pyridostigmine, enough. Clear? Now yes, we understood about myasthenia gravis. And now yes, अब देखो, along with this let me tell you about other anticholinergics. In other anticholinergics we have organophosphates. Okay, in organophosphates what we have? We have malathion, parathion, phenathion, abate, acephate. We have some gases like tabum, sarin, sabum. All those drugs are organophosphate compounds. Actually in previous class also I told organophosphate compounds are very very preferred drugs as insecticides. They are insecticides. Okay, organophosphate compounds are available in oral form. I mean they are rapidly, not they are available, they are absorbed from oral route, they are absorbed from ocular route, they are absorbed from dermal route, they are absorbed from all the routes. हर एक रूट से absorb हो जाएंगे. Why? Because they are having more lipid binding property. Okay, they are lipophilic drugs. Organophosphate compounds are highly lipophilic drugs, so they are absorbed from all the routes. This is one point. Next, organophosphate compounds when they are ingested, they are irreversible inhibitors. Irreversible inhibitors of acetylcholinesterase enzyme. Very very important point. देखो, actually organophosphate compounds what they do when they bind on the serine moiety. देखो, we have anionic site and cationic site. Just now I told. When they bind on the cationic site, they will bind with covalent bonds. Covalent bond. Covalent bond form हो जाता है यहाँ पे. When covalent is a strong bond, right? Once the covalent bond is formed with organophosphate compounds and the acetylcholinesterase enzyme, what happens? The acetylcholinesterase enzyme is totally deactivated. अब उसकी फिर dissociate नहीं होगा. Organophosphate compound is not dissociated from the enzyme. So what happens? Along with organophosphate compound, the enzyme is also metabolized. That means total enzyme is metabolized along with organophosphate compound. This is very important point. अब देखो, there are some drugs called oximes or carbamates. Okay, oximes and carbamates. Oximes and carbamates are also having acetylcholinesterase enzyme inhibitory property. Okay, in OP poisoning conditions, oximes are commonly used drugs along with atropine. Why oximes are used? Because these oximes will try to save the enzyme from organophosphate compound. देखो, just imagine this is a organophosphate, this is a enzyme, okay, acetylcholinesterase enzyme, and we have one organophosphate compound and one oxime. ऑर्गेनोफॉस्फेट कंपाउंड अगर ये एंजाइम के ऊपर बाइंड होगा तो क्या होगा? एंजाइम डिस्ट्रॉय हो जाएगा. अगर ऑक्साइम आके बाइंड हुआ तो क्या होगा? ऑक्साइम विल बाइंड फॉर सम टाइम एंड आफ्टर सम टाइम व्हाट हैपेंस? ऑक्साइम विल रिलीज फ्रॉम द एंजाइम, इट विल डिसोसिएट फ्रॉम द एंजाइम and oxime will be metabolized and remaining the enzyme is saved in the body, right? So if anybody is having organophosphate poisoning, the organophosphate drugs are used to metabolize and we have to save the enzyme. To save the enzyme we prefer pralid oximes. Okay, pralid oxime is also having same anticholinesterase property, but to save the enzyme we use pralid oxime with organophosphate poisoning conditions. I think you understood that point. Okay. So in organophosphate poisoning, all signs and symptoms you can. I think in previous class I told, when organophosphate compound is ingested, what will happen? Patient will have all muscarinic and nicotinic receptors activity. Acetylcholine बढ़ जाएगी. Patient will have diarrhea. Patient will have defecation. Patient will have urination. Patient will have lacrimation. Patient will have reduced amount of heart rate. Heart depression हो जाएगा. Hypotension हो जाएगा patient को. Bronchoconstriction will be occurrent, patient will die. Okay, so all these symptoms. Sludge करके one point one mnemonic I told. SLUDGE. SLUDG is the term salivation, lacrimation, urination, defecation, gastritis and excretion or emesis. All these things will be seen if patient is administered with organophosphate compounds. And all these SLUDG you can write as adverse effects with acetylcholinesterase inhibitors. Anticholinesterases के adverse effects क्या होंगे? Before understanding the adverse effects, let us see the uses. What are the uses of anticholinesterases? Number one, they are commonly used for myasthenia gravis. Very important use. Clear? And in that main drug is pyridostigmine. Yes. And next use, anticholinesterases are used in glaucoma. About glaucoma I'll explain you. About glaucoma I'll tell you in the next lecture. Next, it is used in post-operative urinary retention. In last class I told, urinary retention condition maybe we use anticholinesterases because they'll increase the acetylcholine activity and they'll cause urination. And they are also used in belladonna poisoning or atropine poisoning. And here the drug of choice is physiostigmine. And sometimes very important use, anticholinesterases. This is very important point. Anticholinesterases are used in Alzheimer's disease. Alzheimer's disease में anticholinesterases are used. In that actually we have some drugs. Donepezil, there is a drug called donepezil. याद रख लो ये drugs in psychiatry and in neurology. I'm sorry. These drugs will come. Donepezil. In Alzheimer's disease we use donepezil, and along with that we have galantamine. याद रख लो these drugs. Galantamine and rivastigmine. So in Alzheimer's, donepezil, galantamine and rivastigmine are drugs used in the Alzheimer's. So I think you all know what is Alzheimer's. Alzheimer's के बारे में और डिटेल में I'll explain you later. See, actually in Alzheimer's it is a neurodegenerative disorder where patient will have less cognitive power and cognitive impairment हो जाता. So when we increase the acetylcholine activity in the body, अब anticholinesterases दिए तो क्या होगा? Acetylcholine activity बढ़ जाएगा ना? When acetylcholine activity is increased, what will happen? The cognitive power and memory power and patient will have all signs and symptoms which is associated with acetylcholine. So we can improve these symptoms little bit. So in Alzheimer's disease also anticholinesterases are commonly used. Along with these, बहुत सारे drugs भी है. Alzheimer's का treatment strategy is very different. In that, anticholinesterases are one kind of drugs that can be used in Alzheimer's. Okay, so these are some uses of anticholinesterases. And one more very important use is for organophosphate compounds. They are used as pesticides, especially insecticides. Clinically ज़्यादा use नहीं करते. Organophosphate compounds के clinical uses नहीं है, याद रख लो. Why? Because they are having irreversible binding property. That's why they are not having clinical use, but they are used as insecticides. That you have to remember. Now let us see the adverse effects. अब anticholinesterases adverse effects क्या है? What possible adverse effects are seen? See, when anticholinesterases are given, they will inhibit cholinesterase enzyme, acetylcholinesterase enzyme. When this enzyme is inhibited, what will happen? Acetylcholine will be increased. Acetylcholine increases. When acetylcholine increases, when acetylcholine is increased, what will happen? All muscarinic and nicotinic receptors activity will increase. So when muscarinic activity increases, what happens? All the actions, M1, M2, M3, M4, M5, all actions and nicotinic actions also, NM and NN actions will be increased. Here, lacrimation, salivation, all SLUDG, remember this. इसमें कोई भी हो सकता है, because anticholinesterases can elevate the acetylcholine activity. So overstimulation of acetylcholine, overstimulation of muscarinic and nicotinic actions, these all actions can be seen. So sometimes patient may have overstimulation of NM receptors and patient will have convulsions. Okay. So these are common adverse effects. Main adverse effects क्या हो सकता है? Lacrimation होता है, diarrhea होता है patient को. Diarrhea is very common, and urination is also very common. Okay, and patient will have gastric motility, paralytic movement ज़्यादा हो जाता, and sometimes patient will have movement disorders and lacrimation होते रहता. All these things are very common with anticholinergics. So I think you all understood the. Here I think I didn't explain in detail about organophosphate compounds. About if you want to learn about organophosphate compounds, I'll provide the link in the description after uploading this video. You can watch. So adverse effects we have seen. We have seen uses. We have also seen about myasthenia gravis disease, difference between periodostigma and neostigma, and we have discussed about some important drugs. Okay, so that's it for today. Tomorrow we'll start with anticholinergic drugs. Anticholinergic drugs are very very important drugs used in hospital. अभी तक अपन ये जो cholinergic agonist देखे, cholinergic agonists are not commonly used in hospital, but anticholinergic drugs are very commonly used in hospital. Okay, tomorrow we'll discuss that anticholinergic drugs.